We had a challenge yesterday with folks showing up without an appointment, which greatly delays our processing. Today we're adhering to appointments only, just to make this better for folks and trying to reduce the wait time here.
What do people need to know when they come to their appointment? What do they need to be prepared for as far as waits, as far as documentation?
So when you register ahead of time, all your documentation's all ready to go. So when you get through the line, all they're going to do is scan your QR code, and that will bring up your information, and it'll get you registered so that you'll get your reminder 28 days later to come back for your second vaccine.
The CDC director says vaccinated people shouldn't do it. Listen.
What we have seen is that we have surges after people start traveling. We saw it after July 4th. We saw it after Labor Day. We saw it after the Christmas holidays. Currently, 90% of people are still unprotected and not yet vaccinated.
Right. But if you are vaccinated, what does the science tell you about how likely it is that you get sick when you travel and how likely you can give it to somebody else? Do they know? Do they know when they're playing scared? Do they not know so they're playing scared? Let's get through the facts on this and the science. Dr. Leana Wen, thank you for joining me once again, doctor. So the idea of, no, you still shouldn't travel even with the vaccine. Do you think that's the right call?
I do not. Look, I do understand the situation that the CDC is in. They want to be cautious, and I do have sympathy for that. They don't want to overpromise initially and then have to dial it back. But I also think that there is a cost to saying things that don't meet the common sense test. Air travel, for example, alone is very low risk when everybody's wearing masks. And if somebody is vaccinated, that risk is lower still. The risk, actually, I would be concerned about unvaccinated people who are traveling, going on spring break, going to lots of bars and hanging out and spreading it to one another. I'm not concerned about the vaccinated grandparent who's traveling across the country just to spend time with their extended family. And I think that kind of nuance really needs to be spelled out, or else it's not going to make sense to people, not meet the reality test.
So you have messaging here being balanced with risk because, as you've laid out to me earlier today on the radio show, which is why it's so important for me to have you here tonight to echo it onto this audience, we're in a race, you say, and that we won't always have less supply than we do demand, that we're going to have to motivate people to want this vaccine, and it may not be as easy as people suspect. What do you believe that race is, the variables are, and what the messaging should be?
My main concern is that we're not going to reach herd immunity because of vaccine hesitancy. And I know that's hard for a lot of people to believe who desperately want the vaccine right now. And they're thinking, oh, well, it's just a small percentage of people who are actually anti-vaxxers. And that's true. There is the anti-science, anti-vaxxer contingent. But I think that there are many more people, millions of people, who, for whatever reason, have concerns about the vaccine, who just don't know what's in it for them. And we need to make it clear to them that the vaccine is the ticket back to pre-pandemic life. And the window to do that is really narrowing. I mean, you were mentioning, Chris, about how all these states are reopening. They're reopening at 100%. And we have a very narrow window to tie reopening policy to vaccination status. Because otherwise, if everything is reopened, then what's the carrot going to be? How are we going to incentivize people to actually get the vaccine? So that's why I think the CDC and the Biden administration needs to come out a lot bolder and say, if you're vaccinated, you can do all these things.
You're not the complete boss of me. I control my body, I control what I do, and you don't have the right.
Here are all these freedoms that you have, because otherwise people are going to go out and enjoy these freedoms anyway. And I fear a situation of coming into the fall where we never reach herd immunity, and then we get hit by the next surge of COVID-19 in the fall, something that we could have prevented if we just got people vaccinated now.
Thank you, Dr. Leana Wen. Appreciate it.
You need to shut the fuck up.
Getting vaccinated is not a free pass to essentially throw out all the public health measures. So when I'm in a situation where there are other people around, of which there are not right now, I would be wearing a mask. Number two, I do avoid congregate settings. And when I am, I absolutely wear this mask all the time. I compulsively wash my hands because, you know, when you're dealing with people grabbing a doorknob or putting something down, so I do that. Bottom line is, I really haven't changed anything.
Shut the fuck up. You know I don't want you to say nothing to me. You hear what I'm saying? Respect that.
We know we like you.
Shut the fuck
You
up.
left the-
It's 4 a.m., you blood-sucking mosquito.
Just want you to know we're here to support you,
Shut the
though.
fuck up.
No, just here to support you.
Shut the fuck up. You bully. You fucking mosquito bully. Pick a profession and shit with some type of respect to it.
Have a good day now.
People should not be walking around with masks.
You're sure of it? Because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better.
I think I've got this right. 1 mask is better than 0 masks. 2 masks is better than 1 mask. But you don't have to have double masks. Is that right? I mean,
It is. In fact, Savannah, you and I had this conversation on your show. I mean, it must have been a month or so ago because someone had said, I've seen people wear 2 masks. The recommendation is not that you have to wear it. What the CDC is saying that at minimum, wear a mask. Okay, this is what they're saying. Make sure you wear a mask. So you wear a mask. Then you want it to fit better. So one of the ways you could do it, if you would like to, is put a cloth mask over, which actually here and here and here, where you could get leakage in, is much better contained.
Okay.
That's all they're saying. 1 mask at least, but if you want to really be sure, get a tighter fit with the second mask.
so wait a minute. Are you a double masker, Dr. Fauci? It looked like you are.
Well, I have. In fact, I have used it occasionally, mostly, Savannah, for what the CDC is saying. The fit is better.
You've been vaccinated, and you parade around in 2 masks for show.
If you get the surgical mask on and you put a cloth mask over, those areas around where some aerosol can get in are better fitting. Okay. So again, minimal, at least 1 mask, likely a double ply type of mask, would be good. But if you want to get, if you want to do it further, just get a better fit.
Shut the fuck up. You're a fucking cunt. Shut the fuck up. You're a stupid cunt. Suck my dick. Shut the fuck up. Stop being a fucking cunt. Shut the fuck up. Nobody even wants you here.
I mean, once they're fully vaccinated, can they go back to their normal lives?
In essence, ultimately, yes. The thing you would like to see, Savannah, is if you have 2 parties vaccinated. And that's the question we get asked more often. If I'm vaccinated and my daughter who lives in Boston comes home and she's vaccinated, can we get much more of this pulling back on restrictions and saying we can sit down together without a mask, we can give each other a hug? And the answer ultimately is going to be yes with that.
But if grandma's vaccinated but grandkid isn't?
Yeah, then you got to be careful because grandma could still get virus in her nasopharynx, even though the vaccine is preventing her from getting physically ill. She still could have virus in her nasopharynx. And that's the reason why we say until we have the overwhelming majority of people vaccinated and the level of virus is very low, when you're vaccinated, it would be prudent to wear a mask.
Shut up, bro. Shut up, bro. Shut up, my nigga. Shut up.